Good afternoon, everyone. Today I'm going to be talking with Johnny Smith, a Chair of Education at SOMM, the Society of Musculoskeletal Medicine. So welcome, Johnny. Thanks for joining me today.
Thank you very much for inviting me.
So the purpose of today's chat is to explore the current pathways in MSK medicine and discuss SOMM and Physiquipe's shared goals, essentially, in advancing MSK care and education. So to begin with, Johnny, can you introduce SOMM and its role in MSK medicine?
Yeah, SOMM, well, it stands for the Society of Musculoskeletal Medicine. The society's been around since 1979, and it's really designed for the assessment, diagnosis, and treatment of non-surgical MSK conditions. It was originally, the principles come from Dr. James Syriacs, and for those people who've been around long enough, like when I first graduated, people might have been initially familiar with the approach as the Syriacs approach, but as years have gone by, that's kind of changed, and we've adapted and changed quite a lot over the years. But it's multi-professional, postgraduate, kind of credit rated at MSc level courses. It's nice that it's multi-professional. The majority of people are physiotherapists, but I was teaching on the course of the weekend, and we had osteopaths, podiatrists, GP, sonographers, and sports therapists. So that really aids the discussion in clinical reasoning.
Yeah. Excellent. No, it's definitely great what you guys do. And I think talking about sort of just the general pathways, I think in MSK medicine, so obviously that's including undergrad, postgrad, specialty training, advanced practice, research academy pathways, but CPD and recognised certifications. So as SOMM, where do you see that fits in sort of that educational pathway as a whole?
Yeah, I mean, the courses currently are postgraduate. And certainly with the foundation diploma, if you complete all three parts, you get a diploma in musculoskeletal medicine, which counts as 60 MSc credits. We're credit rated with Queen Margaret University. So people are using these 60 credits to RPL towards, say, advanced practice MScs, or just use them as really good standalone qualifications. We've also got advanced courses, the most popular being the injection therapy course, which counts as 20 MSc credits and is really, really popular. It was the first UK MSK injection therapy course, and that continues to be very popular. So the courses, certainly the foundation, we get a huge variety of experience levels on there. It's brilliant for, say, people a few years qualified to give you that core foundation and almost roots to your tree of MSK practice with clinical reasoning, assessments, anatomy, diagnosis, and treatment. But we also get people, particularly because the course is aligned and mapped to the KSA framework for the stage 1 of the first contact practitioners. So people do these courses to help with advanced practice MSCs or to get APP, FCP kind of jobs in the UK. So a wide variety, and I think that again on the courses.
Yeah, excellent. I think there's many reasons for people undergoing sort of different training pathways, isn't it, along the way as well. I think variety of scope of practice for one in MSK medicine is massive, really. And there's a massive element of continuous learning, isn't there? Like I say, whether that's postgrad, them opportunities of further learning, that has to be facilitated, and you guys obviously, do that to a really advanced level. And I think our remit here at Physiquipe is first and foremost, we want to ensure that our customers are competent at using, what we specialise in, which is technology, and customers and using technology in their practice to be the best that they can. But also, over the years, we want to ensure that we're bridging that gap that can be known in between, medical equipment suppliers and I guess end users, and working together with education providers, like yourself, to change that outlook in the industry, really. Surely, like, working together is a better outcome for all the learners, the opportunities that we can provide as organisations and obviously clinicians in their practice. So I think over the time that we hope that we can provide, that opportunity to facilitate education specific to technology, which, I guess is advantageous to some standard courses, even undergrad education, because, like we've discussed before, they don't always cover the use of such modalities in such detail. So, if there was a clinician wanting to specialise or going down a certain route, then, like I say, then education, those extra education pathways, from specialised organisations, hopefully that, we can support with. And I think that's where Physiquipe and SOMM, as we've said, definitely that alignment sits, being able to benefit each other's pathways, essentially, ultimately supporting learners in the industry, isn't it?
Yeah, no, I completely agree with that. I think, with just thinking of the course I was teaching at the weekend, there's lots of discussions, and we'll discuss when we're treating tendinopathies, we'll discuss maybe the relevance of shockwave. Now, of course, we don't teach that on the SOMM courses, but it's brilliant to be able to signpost where other courses can be done. When we teach injection therapy, the injections we teach are anatomically guided, but we'll often say with certain types of injections, look, if you can do these under ultrasound guidance, or if you can maybe done a diagnostic ultrasound scan beforehand to make sure that injection is thoroughly indicated, that can often be best practice. And when we do our clinical examination and we're doing, say, resisted testing for contractile structures, the discussion can often come about with dynamometers or even using force plates. So I really see a synergy of us being able to, as tutors, we want to be really modern and current. So we want to know about these technologies. And even though we're not teaching those principles, we can signpost.
Yeah, absolutely. And I think from our side, we're speaking with clinicians, wanting to expand their scope of practice every day. So, courses like SOMM is where we will signpost, to them opportunities. Absolutely. And then, like you said, on the flip side, it's, your learners wanting to delve deeper into some elements or technology. If they are thinking of investing, it's getting that competency and that education right before they do. So, coming to us and discussing that is something that hopefully we can definitely provide. Alongside that, obviously we want to sort of get to know SOMM a little bit more with the programs and certifications. You've mentioned obviously you've got a variety of the courses and some of those ones which are the most popular. So the offerings obviously with the courses, workshops and certifications. So what is your main focuses with those? And essentially, what are the main ones that you provide?
The main ones really are the foundation diploma. So that is consists of 3 units, units 1, 2, and 3. So unit 1 looks at the cervical spine, shoulder, elbow, wrist, and hand, and it's 4 days. The first day is a virtual theory day, which we've really enhanced and modified over the last few years, adding in lectures on the importance of lifestyle factors, clinical masqueraders, pharmacotherapy, onward referral, diagnostic imagery, because these things are becoming more and more important for clinicians, both in roles like first contact, but also for me, for example, a physio in private practice. We find that we are seeing a different demographic of people now, whereas someone may well have gone to the GP to check something first because of maybe perceived difficulties. They might be coming to see a private physio first. And as the chief medical officer said in his report at the end of the other year, the importance of comorbidities and clinicians having good generalist skills is really important. So we have a foundation day, then 3 days face-to-face. A unit 2 is very similar format to unit 1, except it's the lumbar spine and lower limb. So they're both 4 days, 3 days face-to-face, 1 day virtual. And then the unit 3 is a 5-day course. We do the sacroiliac joint and thoracic spine. We go over the content from units 1 and 2, but add advanced techniques. And on the 5th day is when people do an exam, which is a practical exam and a written exam. And when people pass that and do a reflective essay, they get a diploma, which is worth 60 MSc credits. So that continues to be, our most popular product, and is I've been teaching on it for 17 years. I think it's a great product, and it's amazing how it's evolved and changed over those years to be in line with evidence. And then the other key product is injection therapy. Been around a long time, very, very popular. And we've just recently introduced as well a 1-day injection therapy CPD update. So for those clinicians who have done the qualifications a long time ago. It's a great recap because, again, that area is continuously evolving and developing. So I think the way I see SOMM, those two courses will remain key, but we listen to our audience, and we're certainly looking at developing maybe one-day products because I think there's huge benefit in the formal education, the 4-day blocks. However, one-day products can be really good for people who've maybe done our courses before and want an update of how things have changed, but also maybe people dipping their toes in, wanting to see what the society's about. So I think we'll do more one-day courses. We're at the moment planning a one-day spinal masterclass day. So I think that's an area we're going to evolve more into.
Yeah, excellent. Sounds really good. And you mentioned about sort of that ever-evolving sort of process, I guess, and sort of with your, your education, then how do you sort of, keep up with that curriculum, what the key competencies and that clinical skills focus, like how do you sort of really try and ensure that you guys are, sort of moving with the time on that?
That's a really good question and a really important question. I mean, first of all, we have some great tutors, a wide variety of different backgrounds. So we have tutors in professional sport, we have advanced practitioners in the NHS, we have physios in private practice, and we're very, very active on sharing all the information, evidence we get, and then we try and put out on social media and put our voice to it. But I guess more formally, we have an education committee. So we meet twice a year where we will really scrutinize the course content, the feedback we're getting from students on our courses to make sure that we are, being current, being modern. We've just produced a fairly recent textbook. It's the 5th edition that came out last year. So again, that's full of current evidence. We have an annual teacher study day, which looking forward to in Liverpool in a couple of weeks' time, where all the tutors from foundation, education, and even the council all get together. And again, we really, really look at the content in detail. So I think all those things ensures we stay current and modern. And I think because the courses are credit rated with Queen Margaret University, that comes with quality checks. We have an external examiner, we have an exam board. So I think people can feel really confident that if you come in on our courses, it's a well-balanced, evidence-based, quite highly scrutinized by many different professionals, rather than, there's so many options out there people can have, which is fantastic. And I think maybe the way people are maintaining their CPD nowadays is certainly very different from me 20 odd years ago. And I think it's fantastic having access to webinars and podcasts and all these things. But it's just, are those things as well rounded, as well scrutinized? And it's important, I think, for clinicians, particularly if you're fairly new, to have a rounded approach to your development. And you don't want things like confirmational bias or things creeping in without you being aware of.
Yeah, no, I completely agree. And I think even from personal experience with graduating as a sports therapist, and I think then practical elements, or just actually sort of the awareness of, going into a workplace and being exposed to, I think it's even just that, personable aspect that you need as clinicians sometimes in the field, and what you're being approached with, and all those skills, even communication skills, everything that comes with actually like in person, and having to in the case you can know your anatomy, and you can know, your differential diagnosis, but there's all those extra things, isn't there? I think when people are on that pathway really of education, that I think, that opportunity of online, the resource driven education I feel like we do have is huge, and it's so valuable now because it gives us more opportunity, doesn't it? I think for learning, definitely, and that sort of opportunity of continuous development, I think, as a clinician. But I think you're right. I think, like you say, that especially that clinical sort of skills focus element, I think you can't take that away, and that's definitely, isn't it, a drive, I think, which is still important.
Yeah, no, I completely agree. And I think what we've noticed as well, just from talking to people on our courses, is I think the clinicians who are coming through now, the physios, the sports therapists on our courses, who maybe did their undergraduate during the pandemic. Of course, a lot of that was online, and we are seeing now, I think, a lack of confidence in therapists' handling skills, manual therapy skills, palpation skills, which of course is completely understandable. But I guess, so for example, the course I taught at the weekend, I said, put your hands up if you do kind of manipulation, and I think about 5 to 10% of people did it because they thought, we're just not being taught it. We've not been taught hands-on skills, which personally, I think you want to get a really good balance. I really like manual therapy in combination with exercise advice and, of course, evidence-based practice. But I think that's where I think if you can get a balance between maybe some of the face-to-face, maybe more formal educational courses to learn some core key skills, and then top them up with the amazing things you can get online and all everything else, that you get a nice balanced clinician then.
Yeah, absolutely. No, I think that's definitely a key thing, isn't it, really going forward? And I think we definitely are learning that as well. Like I say, we're providing education specific to technology. Using technology in clinical practice is heavily practical. We really know that. But there's a lot of theory-driven side of it to technology as well. So it's trying to facilitate, that sort of access to theory, rather than coming, I guess someone just sitting and listening to someone stand and speak for 3 hours. Trying to, and I think that engagement of education as well amongst clinicians and just people in general. I think our sort of attention as well to learning has changed, and I think as education services we sort of have to as well address that slightly, in the fact of we do webinars, and we used to do probably an hour and a half of a webinar, and now we're like, people drop off at 40 minutes. So there's evolving in that way as well, isn't there? I think as and I think it's really important for us always to be thinking of that, and how we can best get people really to grips with learning in the best possible way, because I think we are all evolving in different ways, aren't we, as humans? I think some shape or other. So with regards to I guess some sort of challenges that you face as an education provider, I think within the industry as a whole, or what you see with your students, and what would you say on that sort of side of things?
I think the challenges maybe partly relate to what we maybe discussed just recently. I think maybe it's the way education is delivered, how students are accessing information now. And I think it's, as I said, I think it's amazing how there's such variety which wasn't there when I did when I was a newly qualified physio. There weren't all those platforms, and I think it's brilliant. I love now going on a run and listening to a podcast. It's amazing, but I think it's just trying to get some almost like standard way of accessing, because you may well have some clinicians, some individuals who maybe have maybe brilliant at marketing themselves, maybe are very personable, maybe have large followers, and if that is the maybe sole focus in which way people are getting their educational platforms, are they just becoming a nice balanced rounded clinician? So I think I think the way people access their CPD is almost like a challenge for us, because I think as SOMM we are continuously analysing, because we want to make sure we stay current and modern. And our foundation course being 3 days face to face, we keep on thinking, well, is that what people want nowadays? Do they want to have 3 days away? And I guess the benefits of that, and what we see, particularly when someone maybe does the unit 3 and passes their exam, and we often congratulate people to say, well done for almost putting yourself up to that scrutiny and investing that time and money, because I think they then really feel the benefit of the face-to-face, the hands-on, the practical skills they're learning, in addition to the online platform. So I think that's one of the key challenges. But of course, ensuring our approach continues to evolve. We change the manuals every year based on evidence, and I think that the processes we have in place with the education committee, with the teacher study day, and with our courses being credit rated with the university just gives that that security people can feel confident with.
Yeah, and with regards to sort of, that world of technology, I guess, in MSK medicine as well, like how do you guys keep your ear to the ground, I guess? I know there's, you'll be aware of most things, but like I say, there is lots and lots now, isn't there, really evolving with technology and the use of that in clinical practice. How do you sort of work with that?
Yeah, I think this is where it's brilliant with the depth of tutors we have, because we have when you've got tutors who are in elite sport, they're often more familiar with some of the technologies, the dynamometers, the force plates, which maybe me in private practice don't see as much, or maybe people in the NHS might not have access to. So I think this is why we have that culture within SOMM to really share and disseminate. And I'm sent many messages each week of, look at this article, look at this research paper, look at this technology, which I can then look at and share within social media. But what we do at Teacher Study Days, I produce a document of all the evidence collated throughout the year to go, right, this is what we've got. How might this influence the way we teach? What do we need to be aware of? Because the last thing we want as tutors is to come on a course and someone says a really interesting technology and we've not heard of it, because we're really keen to stay very current and modern. And again, I will do what a lot of people will do. I'll watch the great webinars you guys are putting out and listen to these things to keep current and abreast of technology particularly.
Yeah, absolutely. And I think, we're also, it's very important for us as well to be keeping up to date with, the movement of technology. We are a technology supplier essentially, and therefore, we have to really be keeping up to date with those guidelines of governing bodies and, everything that comes with that as well. So yeah, there's definitely some of those challenges, isn't there, that comes with that. But I think the main aspect of it is that education, providers were passionate about the outcome of learners really getting what they need, these services. And I think that's essentially what we focus on, isn't it, as people who can provide some service to education. So excellent. So just got a few more bits of things to cover, just with questions really. With regards to sort of your main goals at SOMM for the next few years in terms of program expansion or educational innovation, have you got any plans on that side of things?
We're certainly going to look at more multi-professional collaborations between other organisations. There's been a little bit just come out recently. I think SOMM and the MACP are becoming a little bit more aligned. So I think we feel that notion of very much stronger together. I think we don't want to feel that we've got all separate things. We want to combine together to make sure the user has the best overall experience. So we want to collaborate with other organisations. Hence, it's brilliant having this this meeting today to find out more about the benefit this can offer to our students. Certainly looking almost as discussed at maybe one-day products or little master classes in certain things which might be more accessible for people. And I think they're probably two of the main drivers, the collaboration. We are, and I love the fact that the courses are multi-professional. So it's only the last couple of years sports therapists and sports rehabilitators have been able to come on the courses. So I really want to try and facilitate those relationships more, because I think the courses are ideal for postgrad sports therapists and sports rehabbers. And it would be brilliant to get more of those individuals on our courses, because I think that will aid that multi-professional learning and networking. And it was great having a podiatrist and a GP on the course at the weekend. So fostering relationships, fine-tuning our products to make sure we're delivering exactly what the user wants, trying to do some more webinars ourselves. So we're making ourselves a bit more accessible and not just thought of as a 4-day course or a 2-day course like that.
Yeah. Excellent. I will definitely keep our eye out on all of those. Definitely sounds great. And definitely agree with that sort of multidisciplinary opportunity, I think, as well. And I think that just reflects the industry and the fact of, clinicians going into, after uni they can go into a clinic and thrown alongside podiatrists and thrown alongside, physios, if you are a sports therapist and so on. So I think that's really nice to reflect it at that education stage as well. So I think that's a really key, thing for us as well, to be able to signpost like all our audience to this sort of opportunity, because we do sometimes get barriers and challenges to some providers who, like you say, unfortunately it's like you say, capped at a certain level, or it is just a sort of a physio as such who maybe just be accepted. So that's what is one of the key things I think with you guys, and how we want to definitely build that relationship, is to really us to be able to signpost as many as our audience too, because like I say, we have lots of people working in lots of those areas, which I think is really important. So I think that's great. So with regards to sort of MSK education, do you think, and patient care generally, do you think there's anything currently underserved that you guys, sort of essentially, again, I guess, going into that sort of future prospect, really, is there anything really to focus on that you feel, or even from your experiences, and working in private practice?
I think I've got to make sure maybe I don't have individual biases myself, because I very much like manual therapy. I have done for many years, as I said, in conjunction with other things. I do feel though that I don't know, there just seems to be a subtle pendulum swing where maybe manual therapy has become a little bit more popular again. We're getting some clinicians who have maybe had senior advanced roles in the NHS where they've been doing lots of assessment and triaging, but maybe not physically treatment. And some of these individuals are wanting to refresh their hands-on skills. And certainly with the clinicians who were 2-3 years post-grad, they feel that they're lacking the skills of manual therapy. So I do think that is an area that that has the potential to develop further, but of course in line with evidence and as I mentioned earlier with our virtual courses, the importance of the lifestyle factors. We're making every contact count with patients, looking at being able to pick up the clinical masqueraders that we are seeing now probably more frequently. But I do think that is an area that that can be developed a bit further, and I think there is the desire and the need for it personally.
Yeah, excellent. Well, that sounds great. So like I say, you've mentioned lots of essentially new potential sort of one day sort of structures and courses that you've got, and some webinars, which is really good. So obviously we'll be able to share all those bits of details as well. So with regards to I guess the final thoughts on the future of sort of musculoskeletal care and SOMM, how do you hope to play that in the advancing field, essentially, as a message?
Oh, that's another great question. I think at the moment things are changing all the time, aren't they? I think we've got AI at the moment, and it's fascinating to see what's going to happen, how this is going to influence our examination and treatment options. So I think it really is just keeping our ears open, collaborating as much as possible. I will always see the need for the key principles, almost like that light bulb moment people get when they come in our courses, to build the roots for your tree. But I think the tree's branching off in all sorts of different exciting directions. I think with the kind of technologies you guys are producing, which we are recommending, but I think it's going to get even more interesting, particularly with AI. So we're just kind of excited to see where things go.
Yeah, I think that AI is probably another topic of a meeting as well.
Yeah, I think so.
Idea of the tree, and like I said, I hope that we can here at Physichat be at least a bunch of support for you guys. We're offering sort of half day, full day sort of workshops on focus technology, so diagnostic ultrasound alone, shockwave, and sort of working on that force plate dynamometer aspect as well. And we are facilitating the online piece as well, which we've developed last year with that online shockwave course, which we have discussed. And like I say, for that massive theory aspect of shockwave. We're hoping that really facilitates that, 'cause, being able to learn and do that, in their own time, facilitate that sort of online piece, but to be able to then practically come and be exposed to the machines as well is hopefully that piece that we can provide. And we obviously have set up a discount code for your members to be able to access that online shockwave course as well. So like I say, if you are a member of SOMM, then you can obviously speak to Johnny, or you can get in touch with us. We hope that we can help facilitate any further learning if that's appropriate to, like I say, your learners in that side of stuff who want to progress into any technology side of things.
Brilliant, that's great.
So thank you for your time, Johnny. Really appreciate it. And like I say, it's just great to build the relationships really, in which it's just all about sort of supporting each other, obviously bettering education and obviously the pathways available as a whole. So I do really appreciate it. And I'm sure that we'll probably have bits of updates as two separate organisations in another 6 months. I'm pretty sure, or a year. So I'm sure it'd be good to probably have a bit of a catch up again and another sort of session to see where we're at with things.
No, that'd be great, Katie. Thank you very much for the opportunity today.
Great, thank you.
Thanks a lot.